Well, the Omicron variant is taking center stage in the COVID-19 pandemic as it spreads across Arkansas, across the U.S., and across the globe. I caught up with Ray Hanley, CEO of the Arkansas Foundation for Medical Care, on what to expect next. Let's begin first with the Omicron variant. It is becoming the prevalent variant in the U.S., not as widespread in Arkansas yet, but we anticipate that it will be. How dangerous is this variant from what we know?
Well, as of yesterday in the U.S., it's 3/4 of the cases. That's how rapidly it's spread. The news for a while was, well, it spreads easily, but it's not as dangerous as the other. But obviously, the stock market didn't buy that yesterday. Testing lines around the U.S. are very long, not so much in Arkansas yet. But it's a major concern. The hospital numbers have creeped up. We will, I'm sure, get to the stage where it's 3/4 or more of the Arkansas cases. The vaccination rate in Arkansas still lags. I think we're a little over 50%. We've got to keep working on that. One of my teams at AFMC vaccinated more than 100 people in Oakland over the weekend, so we're trying to do our part. What's going to happen shortly, though, I think, is the definition of fully vaccinated is going to change to include only those that have had the booster. Mm-hmm. When that happens, the existing Arkansas fully vaxxed numbers are going to drop until we can catch up with the booster. So we have a lot of work to do there. But the Omicron variant is rightfully a major concern right now.
The Omicron variant, though, we still don't know a lot about it. We know that it's highly contagious. We know that it does infect people, but we have not really seen how damaging it can be just yet. Is it going to cause many more hospitalizations if you have those booster shots? Are you protected enough from it? Those are still some questions that still need to be answered, aren't they?
And those questions are going to exist for a while because the spread has been so very rapid. It's only been a few weeks since we even knew the Omicron variant existed in South Africa. Now it's 3/4 of the case in the U.S. The first death attributed to it was in Houston yesterday. So we got to learn. We got a lot of catch up to do to learn about the Omicron variant. Hopefully, it won't be as bad as the Delta variant. We can be optimistic about that. What we do know is even though there's breakthrough cases with people that have been fully vaccinated, have the booster, all indications are the symptoms are much milder. You're much less likely to get really sick or go to the hospital if you're fully vaccinated and have had the booster. And that's the really good news.
I want you to give me some science here, because I see this on Facebook feeds. I see it in social media posts where there are people complaining that, see, we've had all these vaccines out here and all these people getting vaccinated, and yet we are still seeing new variants of this coronavirus and people are still getting sick. The vaccines don't work. We shouldn't have to be vaccinated because it's not working. Kind of, I guess, address that fallacy of that argument.
The incubator for the new variants are among the ranks of the unvaccinated. And that's particularly true around the world where vaccination rates, particularly in the third world, lag much more behind the US. In South Africa, only about 25% were vaccinated where this started. The variants are going to continue, but the key to defeating the variants is to get more and more and more of the world vaccinated. And when person can travel around the world in 24 hours, it's essential not only to get us vaccinated here at home, but around the world.
With these new variants that we're seeing, they're different strains of the coronavirus. Do we eventually get to a strain like the flu that is not deadly unless it's untreated? Does it kind of dilute itself at some point in time? Do we know?
I think so. I think we are, it's never going to go away, I think. It's going to become a part of the environment just as the flu does. And I fully anticipate that at least annual vaccinations for COVID, and hopefully a combination flu and COVID vaccine is going to be in the future.
I want to shift gears on you for one last question. I'm going to have you put your Medicaid director hat back on. You've been around the Medicaid program for several decades, so you know this issue well. There is a waiting list for families that need medical services for developmentally disabled family members. It was a big topic of debate in the tax cut special session. Maybe tell me a little bit, why have we had such a difficult time getting our arms around that problem for so many years, and will what's been laid out there address that?
Well, the waiting list for the home and community-based waivers, essentially to serve people that were disabled before the age of 2, has been an issue for at least 30 years. It's very expensive. It's not an open-ended entitlement like much of Medicaid. If you meet the institutional definition, if you were in an institution, you'd qualify for Medicaid. The goal is to qualify you at home. But because of budgetary reasons, there is a cap. We've got about 5,000 on the waiver now. There's 3,000 on the waiting list. About half of those are on regular Medicaid, but they don't qualify yet for the very expensive home and community-based services, or sometimes around the clock aid and nursing service. Some 1,300 of those don't get any services at all. So the goal is to let them live in the community rather than an institutional setting. And Governor Hutchinson took a big step last week, announced a phased into the current waiting list with several hundred to be covered immediately. And the goal is to get everybody off the current waiting list by 2025, which will really help these families that are trying to take care of these kids at home. But new cases are going to come and join the waiting list. So it's an issue that's going to be with us for some time to come.